infected with HIV from oral sex. If you're worried about HIV infection, you may wonder whether it's safe to have oral sex. While it's not risk-free, the chances of spreading the virus that causes AIDS are very low if you take the right precautions. The chance that you will get HIV from receiving oral sex, when a partner's mouth is on your genitals, is very low compared to unprotected vaginal or anal sex. But it's not easy to know what the actual risk is. This is because most people who have oral sex also have vaginal or anal sex. It's tricky to figure out each factor on its own. Risk of giving oral sex versus receiving it. It's thought to be riskier to give oral sex than to receive it. This is because you may have small cuts or sores in your mouth, even if you are not aware of them. There's also risk from a partner's fluids, which may get into contact with your mouth and throat. Comparing risks, mouth to penis versus mouth to vagina. Mouth to penis oral sex is thought to be riskier than mouth to vagina oral sex. But the risk is still much lower than with other types of intercourse. Risk of HIV from analingus. The chance of being infected with HIV from analingus, oral anal sex, is also considered to be very low. The bigger risk is that you may become sick from certain other viruses or bacteria that live in your partner's anus. Can you get an STD from oral? Yes, you can get many different types of STDs from oral sex, including chlamydia, gonorrhea, syphilis, herpes, human papillomavirus, HPV, HIV. It's possible to get some of these STDs in your mouth or throat if you give your partner oral sex or analingus. But you can reduce your chances if you use a condom or dental dam. Can AIDS be transmitted through saliva? No. AIDS is actually the most advanced stage of the HIV infection. You don't transmit AIDS, and HIV doesn't spread through saliva, as long as it's not mixed with blood from a person with HIV. How can you become infected with HIV? HIV spreads only through specific ways in the US, including having unprotected vaginal or anal sex with someone who has HIV, with anal sex being riskier of the two, sharing needles, syringes, or other drug paraphernalia with someone who has HIV, as the needles could contain remnants of blood, which could have HIV, in very rare cases. HIV also can spread via oral sex, blood transfusion or organ transplant, during pregnancy or breastfeeding, needle stick. Body fluids that transmit HIV. If someone is infected with HIV, their body fluids, such as blood, vaginal and anal secretions, semen, and breast milk, contain the HIV virus. Those fluids can enter the bloodstream of someone who doesn't have HIV during any type of sexual activity, including oral sex, through an opening such as a mouth sore or a genital ulcer. Your chances are higher of getting HIV if you have sores in your mouth, vagina, or penis, have bleeding gums, are in oral contact with menstrual blood, have another STD. How to protect yourself. Since there is still a chance that you could get infected with HIV through oral sex, you should always take precautions. Here's what you can do to lower your risk. Do not let a male partner ejaculate in your mouth. You can do this if you remove your mouth from their penis before they ejaculate, or insist he wears a condom. Use a condom or dental dam. A dental dam is a thin square piece of latex or silicone that you place over the vagina or anal area during oral sex. You can also cut a latex condom lengthwise and use it the same way. Both of these barriers also lower the risk of infection from other STDs, such as gonorrhea of the throat or hepatitis. Use a new one every time you have oral sex. Check the expiration date on the package, and make sure there are no tears or defects. Don't use oil-based products such as baby oil, lotion, petroleum jelly, or cooking oil on condoms or dental dams because that can cause them to break. If you need lubrication, use a water-based or silicone-based product instead. Ask your partner to use a condom, or if you are a woman, use a dental dam during your period, as the virus can be present in menstrual blood. Don't brush your teeth just before oral sex. If you do, your mouth or gums may bleed, which raises the chances of infection. Skip oral sex during risky times. This includes a time when you have sores around your mouth, genitals, or anus, for example, a herpes outbreak, gum damage, a throat infection, or after dental work. If your partner is HIV positive, the risk is lower if they take medicine to treat HIV, antiretroviral therapy or ART. This suppresses the virus so it can't spread as easily. You can also take an HIV prevention medicine, such as PrEP or PEP. Talk to your doctor about your options. Takeaways: your chances of getting HIV from oral sex are very low, but it's still not zero, so you should still protect yourself. You can use a condom or dental dam, which will also help protect against transmission of other STDs. Avoiding oral sex during certain times, like menstruation, when you have a sore throat, and dental infections, can also help prevent HIV from spreading during oral sex. Can you get HIV from oral sex? FAQs. Should I get tested for HIV after oral? The CDC recommends you get tested for HIV once a year if you've had more than one sex partner since your last test, or you've had sex with someone and don't know their sexual history. But if you think you've been exposed to HIV, you should get tested immediately. HIV self-tests let you get results in 20 minutes. How long does HIV take to show up? Symptoms of HIV can appear within just a few weeks after you've been exposed to the virus and might feel similar to the flu.